five biggest killers of Americans today, four of them are related directly to obesity: diabetes, hypertension, heart disease, and stroke. The only one that's known is smoking. And we deal with those four diseases and obesity, plus a bunch of other family medicine issues and general practice issues. It gives me a lot of information, which is what I like about it. The information that I get is based, one of them is excellent, tells me about patients' anxiety level. That's the first graph. That's the way that I interpret it. Many doctors can look at it in different ways. It also gives me about the neurological, any neuropathy that they may have, cardiac variability, a risk of sudden cardiac death in the future, the chance of having diabetes, hemoglobin A1C assessment, as well as parasympathetic-sympathetic balance, which is very important for us to know when we're dealing with a patient. And it gives you a bunch of other graphs at the end that assess total risk. And when you take the information collectively, as well as you chop it off by pieces, you can use that information in order to change clinical outcomes, change clinical treatments of the patient. And number one, that I use the tool is to motivate the patient to follow some of the clinical guidelines that you've already set for them, be them being having better control of the diet, having better control of the glucose, controlling the hypertension. So by doing that, we can really get the patient to understand how their disease impacts their body. We have not had any issues with billing for the codes so far as I know. So we've had a smooth ride with the billing codes. We have not had any insurance deny the claims. Some of the insurance have sent it to secondary insurance, and then we have to wait for the secondary insurance to pay. But I do not know of any cases that we've had the insurance deny the payment. If your practice sees patients who have these conditions, and I think any family doctor, any internist, any cardiologist has this type of practice will benefit from this machine because this machine covers so many different diseases and it's so beneficial that I think that a vast majority of doctors will see much better patient outcomes, an increase in the revenue stream, and it's a very easy machine to use that is not complicated to get started in an office.